This is the historic city of Peshawar, which is the gateway to the famous Khyber Pass. The city has a population of 3.57 million, with 47.4% male and 52.6% females, between the age 15 to 49 years, which is an internally accepted age for childbearing. The population growth in KPK, like in other parts of Pakistan, is a cause for concern as it has implications for the quality of life citizens, as it places a huge burden on basic needs services such as health, education, water sanitation, and livelihoods. The population program of the government of KPK has specified its population targets, which are achieve universal access to safe and quality reproductive health family planning services, to increase contraceptive prevalence rate from 28.1% to 37%, decrease fertility level from 3.9 to 3.3 births per woman, to reduce unmet needs for FP from 30% to 10%, reduce population growth rate from 2.05% to 1.8% per annum. The existing primary family planning services are located in the 62 family welfare centers, the bulk of which are in rented spaces, while 8 family welfare centers are housed in basic health units of the health program in District Peshawar. The 48 basic health units in District Peshawar, now outsourced to PPHI, also required to provide family planning services. The FWC is the core unit and cornerstone of the main service delivery network of the population welfare program, catering to a catchment area of 7,000 to 10,000 population. The BHU are located at Union Council level and are meant to provide the first level care to patients referred by LHWs and TBAs. It serves a catchment population of about 25,000 people. There are 48 BHUs in District Peshawar. The National Program for Family Planning and Primary Health Care, also known as the LHW program, has a synergetic effect on the activities of the family planning. Some of the major responsibilities of LHWs related to MNCH services include monthly home visits to the 1,000 population covered by each LHW for the registration of pregnant women, reporting of skilled birth attendance, maternal deaths, and providing information about modern family planning methods. Community Uplift Program CUP Pakistan is a national NGO working since January 2001. It has a major program in place in KPK with family planning and reproductive health as a major thematic focus. CUP Pakistan is the grantee of DFID Future Group Funding Initiative, initially for a 10 months, April 2015 to February 2016, pilot phase project titled Improvement in Quality of Family Planning Services through Citizen-led Performance Monitoring of Family Planning Services Facilities. This pilot project has been conceived with the overall goals and framework of the DFID-funded Provisional Health and Nutrition Program with the government of KPK, which aims to achieve reproductive, maternal, newborn and child health and nutrition results over 4 years 2013 to 2017. The overall goal of the project is to develop a model for improving access, outreach and quality of family planning services through citizen-led monitoring and feedback using Community Scorecard (CSC) on a sample of 9 family planning services facilities located in BHUs and family welfare centers in District Peshawar. The CSC is an interactive social accountability tool that was applied by citizens as well as the family planning service facility staff through a social mobilization phase, followed by input tracking sheet, community generated performance scorecard, family planning service facility staff generated self-evaluation performance scorecard. This prepared the stage for 3 joint interface meeting between users, citizens and family planning service facility staff to analyze the identified issues through the CSC in order to arrive at time-bound agreed action plans.
Can assure the stakeholders of the project, that is DFID, Future Group, CUP Pakistan, civil society organization, and most importantly, the users, citizens of my full backing and support in the achievement of the objectives of this pilot project.
This scoring set the scene for 3 glorious interface meetings, each for 3 service facilities on 9, 10 and 11 September 2015, wherein the users and service facility staff comprising medical officers, LHVs, family welfare workers and LHWs, during these interface meetings, 9 agreed action plans for each of the 9 sample family planning service facilities were developed and supported by the DPW and DSM. 3 joint citizen monitoring committees comprising users and service facility staff are members with the DPW and DSM of PPHI as its chairperson. The 9 jointly agreed action plans developed and at least 50% of the action plans implemented. Currently, there is an ownership of the pilot project at the highest tiers of the government.
बिस्मिल्लाहिर्रहमानिर्रहीम। मेरा नाम रोज़ीना ज़िया है और मैं एज ए एक्टिविस्ट ख़ज़ाना BHU से ताल्लुक़ रखती हूँ और मैंने कम्युनिटी स्कोर कार्ड में के पूरे प्रोसेस में हिस्सा लिया है और उसमें इसके बाद जो है 2015 में सितंबर 2015 में हमने जो है इंटरफेस मीटिंग में शमूलियत की थी।
इतना कहना चाहूँगा कि ये हमारे डिपार्टमेंट और जनरल पब्लिक दोनों के लिए बहुत बेनिफिशियल और इन एक्टिविटीज़ या आप सही रोल प्ले करते रहेंगे तो मेरा ख्याल नहीं कि हम इसमें अपनी परफॉर्मेंस भी इंक्रीज़ करेंगे और लोगों में अवेयरनेस भी बढ़ती जाएगी और मैं समझता हूँ कि ये एक्टिविस्ट इनको ज़्यादा ऑन रोल किया जाए। मैं समझ एक एक्टिविस्ट की जगह 2 एक्टिविस्ट रखे जाएँ ताकि वो रैंडम बेसिस पे हमें 2 एक्टिविस्ट से भी काम हमें जो इंफॉर्मेशन मिलेगी वो हम एक एक्टिविस्ट की रिपोर्ट के साथ हम दूसरे को टैली करके अच्छा रिजल्ट ले सकते हैं।
I am Iftikharur Rahman, the Chief Executive of Community Uplift Program, Pakistan. This project is a very nice project because it's an innovation where we apply the community scorecard process by which citizens express their own point of view about the service delivery in health and population, and the facility staff, they themselves score their own service evaluation. Eventually we come up with an agreed action plan through several interface meetings, and then some joint citizen action committees are formed which monitor these agreed action plan, and eventually we bring them to a conclusion. So I feel that this has to be institutionalized and made widespread in all citizen government ventures so that the quality of services improve. I would like here to mention the tremendous support which this project has got from the government of KPK, especially the Secretary Population Welfare and the Secretary Health of KPK.